Hello everyone. Today I want to talk to you about estrogen, one of your steroid sex hormones. So what is estrogen? It is produced in our ovaries as well as in small amounts from our adrenal glands and our adipose tissue, so our fat tissue. Initially, estrogen starts to develop secondary sex characteristics, so that's breast development, skin changes, pubic hair, and then it'll start our menstrual cycle. So with respect to our reproductive health, estrogen is what helps build a healthy uterine lining. And then as well as when estrogen rises in the menstrual cycle, it's what's going to stimulate the LH surge from the pituitary to then allow ovulation to happen. As well, estrogen is responsible for producing fertile cervical mucus, as well as maintaining vaginal lubrication and an acidic vaginal pH, which actually helps protect you from any infections. So, beyond reproductive health, estrogen is really important. Our bodies have estrogen receptors on every system possible. Today I want to highlight some key ones that are really important to our health as women. So one of those being our weight and metabolism. Estrogen is really crucial for this system. It can influence where our body puts adipose tissue, how quickly we can burn adipose tissue, so adipose being fat. With declining estrogen, we see an increase in abdominal adipose. So estrogen is going to be a factor in that pathway. As well as estrogen for women is also very important for developing and maintaining muscle mass. So with declining estrogen, we see increase in adipose and decrease in muscle tone. So it's super important for that pathway. Estrogen, also super important for bone health. Our bones have estrogen receptors on them that help bone turnover to help us produce and maintain healthy bones. This is really crucial when it comes to the menopause timeframe when our body starts to lose estrogen. That's when we see a dramatic increase in osteoporosis and fragility fractures. So we need to make sure during our reproductive and I guess non-reproductive but premenopausal years, we're maximizing our estrogen exposure so we can help our body build healthy bones to prevent fractures down the road. Another crucial point or factor that estrogen plays in our body is with respect to our cardiovascular health and how estrogen can impact our blood lipids, so that being our cholesterol, our HDL, our LDL. So estrogen helps keep HDL high and LDL low. So we see with a decline in estrogen, you actually have unfavorable cardiovascular, blood lipid profiles. So super important with respect to any cardiovascular event and preventing those. We want to have nice, healthy, robust estrogen to keep those blood lipids in check. So those were just some of the things that estrogen does for you. I wanted to highlight them. I feel like estrogen's really honed in on with the reproductive system. Yes, super crucial for our reproductive health, but beyond that, it does so much for our body. Estrogen is one of our superpowers as women, and we want to make sure we're optimizing it, maximizing it, and have healthy and happy hormones to maximize our overall health. So that was a little estrogen in a nutshell. Next, I'm going to be speaking to progesterone.